Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Hi there, I'm Bill Latimer, the host of Public Health America. In our program, we interview our guests to talk to them about challenges that they faced and met in order to attend college and succeed in college, and how important that was to establishing a career where they earned good money, where they had access to health care, and could build a life for themselves and their families. Well, it's come to our attention, particularly now during a period where a lot of people are applying to college, a lot of traditional age high school students and non-traditional age adults. But they're encountering a problem, and that problem is not uncommon, and that is filling out the FAFSA, the free application for federal student aid. When you fill out the FAFSA, that determines or helps to determine what federal student aid you're eligible to receive in the form of grants, scholarships, and loans. And we hear time and again from a number of people that wanted to go to college that they didn't fill out the FAFSA or didn't fill it out in time and then weren't eligible for the aid that they might have gotten. So at Chestnut Hill College, we're here to help with a FAFSA helpline. You can call 516-526-7566, and we will connect you to people that will provide you with information on how to complete your FAFSA. And that will be critical in helping you to determine how to pay for your college experience in an affordable way and in a way that doesn't burden you with too much debt. So call today, 516-526-7566, and we'll help you with that process. This is Public Health America. I'm your host, Dr. Bill Latimer. Welcome to Public Health America. I'm your host, Dr. William Latimer. It's my pleasure to have with me today Dr. Jasmine Mena, Professor of Psychology at Bucknell University. Welcome, Jasmine.
Thank you. It's so good to be with you.
Thank you so much for taking the time. So I know you're doing some cutting edge work on diversity, equity, and inclusion, particularly in the area of psychology. And obviously there's so much complexity in that work today and so much needed. Tell us about your work.
Sure. It's important to me to make sure that psychology is addressing the needs of the people that it serves and that it seeks to understand. In order to do that, we have to pay attention to the diversity of the participants in our research, the diversity of our students in our classrooms, make sure that they're included in the field in every respect, as well as in the research process. I think that's the only way that we are going to truly see improvement in the mental health, physical health, and well-being of all of the people in general. Mm-hmm.
So tell me a little bit about some of the specific things that one does to accomplish that.
Sure. So in thinking about teaching, I like to think about things that we can do as an individual, things that we can do in our courses, and things that we can do when we think about the curriculum as a whole. So as an individual, we need to always strive to increase our awareness, to develop our critical consciousness, to understand the experiences of diverse people. So that's one example. Ourselves, our own awareness. In our courses, we can do things like make sure that the students feel meaningfully engaged in the work. In other words, the topics that they are discussing are relevant to their communities and to the challenges that their communities face and to possible solutions they face. This can be done through assignments. This can be done through methods in the classroom that help students feel connected. In the curriculum, we need to think about our students grappling with issues of diversity, equity, and inclusion across their years in their program or their major. We need to analyze as a community of professors, are we all working together to make sure they get that education throughout?
So, and that makes a lot of sense. And quite frankly, as you say it, it sounds like it ought to be straightforward. And yet, as a college president here at Chestnut Hill College, and also, the programs affiliated with Mercy College in Westchester and the Bronx and Manhattan, they're all one doesn't have to look too far to find situations where, for example, someone brings in an outside speaker to focus on diversity, equity, and inclusion, and then there's some kind of outcry that it's the wrong person. Or you don't bring the person in, and then there's an outcry that you're not doing enough. Or that we're not getting diversity, equity, inclusion really in the DNA of the campus, which I think all, thinking people genuinely want to do. So maybe what I want to ask first, before I ask the question I was about to ask, is what do you see as the challenges of getting true diversity, equity, and inclusion into the DNA of a campus? Is that
Okay, that's a huge question. You know that. Um, So, a big part of it, I think, has to do with changing practices, norms, and our culture. So that takes time. So I feel like the conflicts and challenges that arise as a result of our efforts are to be expected, and it is okay if we are critiqued. It is okay if we don't get it right the first time, but we need to keep working toward mm, working towards the value that we understand is the right thing to do. And so confronting respectfully all of the challenges that come as a result, because what we're asking people to do is to think differently and to accept deep changes in the way that they're accustomed to doing things. That's destabilizing. So it's not necessarily going to be a smooth road, but as long as we're guided by good evidence, by empirical evidence and science and practice evidence, and values that are in line with what we're hoping to achieve, we can keep moving forward. But in order to create something new, sometimes some destruction or some change, painful changes, have to happen.
I think that's incredibly helpful and wise in its presentation, in the sense of just understanding that real change takes time and brings with it some degree, if not maybe even a fair degree of anxiety, angst, and maybe to accomplish that change. Are there any best practices? Are there any institutions that we can look to that seem to be a little bit ahead of the curve and have implemented, some best practice? And as you say, looking at data, and following the data that like what data would we be looking at to demonstrate that we're doing a better job? Like one thing that comes to mind and that I've done is increase the number and proportion of faculty of color, because there are quite a few institutions nationally that serve underserved populations, students of color, LGBTQ, veterans, but the faculty don't necessarily represent or reflect the diversity of the student population. So hiring more diverse faculty is a concrete outcome that makes sense to me. What are the other signposts of success, and are there institutions that are demonstrating success?
Certainly, we can look at so many research studies that have examined pedagogical approaches and strategies such as group-based learning, collaborative learning, things like that help students of diverse background feel a sense of belonging to the field. So that at the level of courses, I encourage you to look at a lot of the literature in the teaching of psychology, journals that certainly provide us with some guidance. And that at that level, I have to say the most challenging part is the institutional level changes. There are many institutions making a lot of progress. One that stands out for me is Bates. Bates, one of the most remarkable and most challenging things that they've been able to accomplish, and this is not to say that others haven't done this, but I'm very aware of their work, is that they have embedded these values of diversity, equity, and inclusion into a faculty review. And frankly, that's the heart of the classroom, in the sense that faculty, how they're reviewed is going to impact how they behave, the practices they hone and grow. And so being able to do it at that level signals that this is the direction that we're heading in a very meaningful and powerful way. Now, I happen to know that it's not necessarily smooth and easy to make such a dramatic change. It has to be well supported. And so my understanding is that it was supported with a lot of resources, time and guidance and consultants, and lots of support to show faculty that they still do have academic freedom. They still very much can do what they value and want to be doing, but has to be part of it. Diversity, equity, and inclusion has to be part of the good work that they're doing. And so they stand out to me as a powerful example to emulate.
That's great. That's exceedingly helpful, and what makes and a great summary too, because it's not, you sort of outline the wide array of things that Bates did to sort of make that work, as opposed to just mandating it. That it probably took 18 months or some amount of time to really pull that together, probably in a collaborative way with the faculty. So yeah, that sounds like a wonderful outcome, and makes a lot of sense, worth considering. So what do you see as the next steps of your work, either at Bucknell or just in terms of your research generally?
Yes, I am very excited about finding ways to push the conversation to the collaboration between faculty members in departments. So we've spent a lot of time in the literature discussing students' sense of belonging and sense of community and how important that is, but less so on faculty sense of community and belonging around DEI work. So what I suspect is happening is that many faculty members are teaching a lot of the same things across the years that a student is in their tenure at an institution. I'd like for faculty members to talk to each other more. We need to create the scaffolding to make that happen, but to talk to each other about how they are addressing the key themes of DEI in the curriculum, and coordinate at what point a student will be exposed to what knowledge. Because if we're all teaching the same foundational knowledge in many of our courses, students are just getting a repetition as opposed to a scaffolding and advancing. So if I know that some of my faculty colleagues are teaching certain topics and themes, then it frees me up to teach other, perhaps new and more advanced topics and themes. But that can only happen if we communicate with one another. One of the biggest challenges in doing that is the threat of evaluation and perhaps feeling unsupported. So we need to lay the foundation, create a program, a system for faculty members to feel safe and be able to communicate with one another and plan the curriculum in a coordinated manner.
That's great. Very helpful, very clear, and a great mandate for work ahead. We're going to take a quick break. When we come back, Dr. Jasmine Mena will tell us a little bit about her life story and how her own undergraduate experience was crucial to the next steps and the ability that she now has to do this great work in her career as a psychologist, a professor of psychology at Bucknell. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back. Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Jasmine, what we do at the beginning of this segment or this part of the show is I always start with the same question, which is tell us where you were born and a little bit about your formative experiences.
Sure. I was born in Harlem, actually. I lived in the Bronx. I lived in Richmond Hill, Queens, and in Manhattan. But we moved to the Dominican Republic, which is where my family is from, when I was a child. And that was an amazing experience. However, it had the effect that when I came back to the United States, I had lost a lot of my English reading comprehension skills. So that created quite an adventure trying to figure out how to get all caught up. So I was retained and I took part in lots of reading program in order to get some of that back, which I eventually did. So definitely there were some bumpy periods in that time.
That's a wonderful and amazing background. Tell me a little bit about I'm first of all, a real specific question. How old were you when you came back?
So honestly, the full story is I went to the Dominican Republic for about a year, came back for about a year, went back for about a year, and then came back. So when I came back and stayed, I turned 10 in Richmond Hill. So it was like 8 to 9, 9 to, 8, 9, 10, actually, and then 11, turned 11, in the United States. So it was quite an adventure. I didn't feel like it was particularly tough. It's just like a kid going through, like, this is what we're doing now. And there were lots of amazing experiences. For example, I lived on a farm for a year with my grandparents, which was incredible. I always think back to that time as a very special time for me, which was different from going from Manhattan to a farm, right? So that was an amazing experience. And then I learned Spanish very quickly by immersion in the Dominican Republic, right?
Right.
Mm-hmm.
You make such a good point that makes sense to me as a father of 3 young children, and that is, because obviously the pandemic has been just a terrible nightmare, but I do think we're seeing in our youngest children a fair degree of resilience, depending on what their experience was during the pandemic. I mean, obviously there's been an enormous variability, particularly in urban settings that were hit harder, had lower uptake rates of vaccine, et cetera. But I do think that there's some data that show that kids are happy to be back at school and that they're adapting fine. And you're very clear about your experience. You went back and forth. You had some amazing experiences in Dominican Republic. When you would go back to the U.S., was there ever any kind of cultural glitches, or was it just pretty seamless because you were just an adaptable kid?
Well, I think the most interesting thing that I remember is that when I was in the Dominican Republic, my peers used to call me La Americana, the American, right? And in New York, no, I was not there. I was like, where are you from? So clearly I was someplace else. So it was interesting how you're perceived depending on your context, which is not at all surprising. We know that happens. But that was a funny little part. But besides getting all caught up in reading and all of that, I think everything else, went well. I always really loved learning. And so I just became curious about whatever I was being taught and just kind of went with that. I ended up really having a deep love of reading, despite the fact that I had so many difficulties with it early on. And that was something that really, I think, helped me grow and led me to my education, is that love of reading and just reading whatever seemed interesting to me. Mhm.
Sure, that's great. So let's move along. What were some of the factors that led you to attend college, undergraduate college, and where did you end up attending?
Sure. So my family and I moved to Providence, Rhode Island, and that's where I went to high school. I went to a public high school there that had a really strong emphasis on college preparation. It was classical high school, and really they did a lot of supportive, a lot of coursework and intensive work. I remember like in tears sometimes doing my homework for hours at night. But that really helped to prepare me, I think, for college. I almost didn't go to college right away because I didn't know how to fill out the FAFSA. The FAFSA used to be a paper form, not online, and
Yeah.
that's what I had to fill out. And it was so complicated to me, and my mother couldn't help me. Really, I just said, if it's really important, somebody's going to tell me about it. So I put it in a book and I put it in my bookcase and I forgot about it. And so I had absolutely no financial aid. And my guidance counselor, oh my goodness, he just helped to to complete the FAFSA and so I ended up going to my local college, and I had a great experience there with great professors. That was Rhode Island College. And so, yeah, there was a moment there that was just like, well, you didn't do the FAFSA, you have absolutely no money to go anywhere. So that was very jarring. And I did end up going there through a program that's called the prep program, college preparatory program, for students that for whatever reason, I don't know exactly the criteria they were using, needed some extra support. So they provided financial support, they provided counseling, they provided a summer program that got me ready for college before the college started. So all of that really helped to get me ready for the rigors of undergraduate education.
That's great. And I don't even know how many interviews we've done now, many, and not a single person has mentioned the FAFSA. And now that you say it, I'm grateful that you have, because I also know administratively that the FAFSA, the filling out the FAFSA still represents a massive barrier to so many prospective students. And we get so many frequent stories of young people that either didn't fill it out or filled it out late. For the audience, what the FAFSA is, it's in effect, the form that you fill out to be eligible or to have your eligibility for federal funding, like Pell funding, evaluated. It includes things like they figure out the estimated family contribution, and it's largely based on income. And Jasmine, feel free to add anything to what I'm saying. But if you don't fill it out, you can't get that funding, and that then becomes a massive barrier. And it sounds like your high school counselor was instrumental in helping you. Did you get did you get some
Yes.
funding at the
Yeah, it
beginning?
all got sorted out. It felt all miraculous to me, but Mr. Toro was my guidance counselor, and he helped me fill it out very late. Then he called the college preparatory program because he knew people there. They interviewed me at the program, and they ultimately decided to accept me through that program. So the combination of getting the FAFSA in late, I was eligible for support, and then the support of the program, because clearly I needed some continued guidance, because have you heard of the hidden curriculum? So these are things that if you come from a family with higher level of education, they kind of can give you tips as to what you should be doing next. But if you come from a family without that background, they can't always kind of alert you to, like, make sure you do this, make don't forget to do that, go, talk to so and so. So I didn't have any of that, and so the college prep program was, I think, the perfect match for me,
Right.
to get me to understand those hidden details.
No, and Jasmine, so important. I will mention briefly at Chestnut Hill College here in Philadelphia, we have a new program where every single undergraduate is assigned a student success mentor. 55% of our students are Pell eligible or low income students, and many of them uh, do have the kinds of needs that you've just described. And by the way, it's not, that is not uncommon whatsoever. So having an awareness of that and being responsive at the college level is absolutely critical. So Rhode Island College, what was your major?
So I changed my major 3 times. So, I started as a theater major. I absolutely adored my high school theater community, so I thought I would continue there. But I didn't connect with the major. Then I switched to communications. I wanted to be a journalist. Again, didn't connect there. And then it just clicked one day, and it felt like so obvious to me that psychology was the major for me. In looking at the courses that they offered, the focus, the focus on people and human well-being and development and psychotherapy and all of that just clicked, and I just like flourished once I made that decision, pushed forward with that, and then even continued on to graduate school because it was such a good match.
That's great. And where did you go to grad school?
I went to graduate school at the University of Rhode Island.
Got it.
I stayed within state and connected with the University of Rhode Island. And there I completed a clinical psychology, first my master's and then my doctorate in clinical psychology.
That's great. That's fantastic. So as we wind down here, if there was one piece of advice that you would give our listeners that are thinking about attending college and the significance of that, other than, but in addition to fill out your FAFSA early, what would that be?
Without a doubt, it would be, don't be afraid to fail. Move forward, even if there is the possibility that you're going to fail at something, because you very well might not fail at it. And at the very least, you're going to learn so much about yourself in the process. So move forward without, being afraid to fail.
That's great. And I think fabulous advice. What an absolute pleasure today to be speaking with Dr. Jasmine Mena. I also want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America. See you next time. Until then, take care.